Today I am going to talk on Epleys maneuver meant for benign paroxysmal positional vertigo. First of all, I would like to tell you what is benign paroxysmal positional vertigo, called BPPV in short. This is a clinical condition in which the patient gets rotatory vertigo in certain positions of the head. The condition is called benign because the condition disappears, regresses after some time. It is called paroxysmal because the attacks come in suddenly, and positional because the giddiness occurs in certain positions of the head only, not in other positions. This is one of the commonest causes of vertigo in ENT practice. What is the cause? The cause is liberation of calcium carbonate particles in the utricle, which get collected in the ampulla of the posterior semicircular duct. Thus, the sensory end organ is stimulated and resulting in giddiness. Now, I will try to explain with the help of the diagram the basis of Epleys maneuver. So this is the right membranous labyrinth. This is the vestibular part. This is the cochlea. In this you see, this is the utricle. This is the saccule. This is the horizontal semicircular canal. This is the posterior semicircular canal. And this is the superior semicircular canal. In the erect posture, as you see that the ampulla of the posterior semicircular duct is most dependent. So the calcium carbonate particles liberated in the utricle, they get collected in this region, and when the position of the head is changed so that these particles from the ampulla come into the duct, the sensory end organs are stimulated, resulting in giddiness. The aim of this Epleys maneuver, which has been described by John Epleys of USA in 1980, is to facilitate the passage of otoconia from the ampulla through this duct or the posterior semicircular duct through the cus commune into the utricle, from where these otoconia get absorbed, and thus the symptoms of vertigo are relieved. So the movement is done in a systematic way. So as you can see, this is the most dependent part in the erect posture. Now I will be moving the head so that this is moved, and due to gravity this particle will come into the utricle slowly and slowly, just due to gravity. So it has reached the crus commune. So this movement is done in a slow and gradual way. And now we can see that due to gravity, these particles have come into the utricle. And now the position is maintained in such a way that the utricle remains at a lower level than the ampulla of the posterior semicircular duct, so that these particles do not enter into the ampulla again. And the position of the head is maintained in this position for about 7 to 10 days, during which time these otoconia get absorbed, and thus relief of giddiness occurs. Should there be some residual giddiness, this means that all the otoconia from the posterior ampulla of the posterior semicircular duct have not gone into the utricle, some particles have remained in the ampulla, leading to recurrence or persistence of giddiness. In that case, this Epleys maneuver is repeated and thus there is freedom from the symptoms. Should symptoms persist in spite of repeated Epleys, in that case surgical treatment is necessary. As you know, this giddiness can occur due to otoconia entering into any canal, lateral or the superior, but as the posterior semicircular duct ampulla is in the most dependent part in the erect posture, benign paradoxal positional vertigo of posterior semicircular duct is the commonest. For carrying out the Epleys maneuver, you have to find out whether this is on the right side or the left side. Now I will be telling about the Epleys maneuver, how it is done with the help of a model.